Hello. Today I have with me Lynn Schulte. Lynn is a pelvic health physical therapist for over 30 years, and she is the principal instructor and founder of the Institute for Birth Healing. She has successfully healed thousands of women from all the issues women experience after birth and is now teaching courses to body workers to help them do the same. She found a common birth pattern that shows up in the pelvis after birth and knows how to effectively release these patterns. Knowing we are more than just our bodies, Lynn works on all levels, physically, energetically, and spiritually, with women to help them access their full potential. She also teaches body workers how to work with energy of the body and how to access and use your intuition in your bodywork sessions. She offers a certification process to help birth professionals become birth healing practitioners. Lynn holds a Bachelor of Science in Physical Therapy from St. Louis University in St. Louis, Missouri. Lynn, welcome, and thank you so much for joining me.
Thank you so much for having me, Kelly. I love any opportunity I get to talk and share what I know.
I'm really excited because I remember being very challenged after my births and trying to figure out what was going on with my pelvic floor. And I'm excited to learn about these patterns that you've picked up on and how we can work through them.
Yeah. It's super important, and not a lot of people are talking about this. So that's why I'm so passionate about getting this idea and these ideas out into the world because it helps moms so much more in their recovery after
Oh,
birth.
yeah. Yeah, nobody wants their pelvic floor hanging out their body.
Right? And there's a reason it is. So I
Yeah. Can you tell me a little bit about how you got into this?
Yeah, well, I know you do birth stories on your
Mhm.
podcast, and my birth stories, everybody asks me, "Well, did you get into this because your birth story was really bad?" And it was like, "No, I actually had really beautiful births, 7 and 8 hours of labor, and I actually after the first birth, I was so lit on fire after the baby came out that I was like, I have to do this. I have to work in the birth field, and I don't know. Do I need to become a midwife or a OB or a labor nurse or like what do I need to do to work in this arena because it just lit a fire in me. And then I went back to taking care of baby and raising family, and I was doing women's health physical therapy at the time, but I really didn't get into working with the pregnant and postpartum population until about 10 years later when I moved from Seattle to Boulder, Colorado. I had to start my practice all over again, and that's when I was just seeing postpartum women. And what was unique about that is that most pelvic health therapists, they see a variety of clients. And so for me, when I was just starting out, I was only seeing postpartum women. That was the only thing that was coming into my clinic. And that is what allowed me to find these patterns in the body because everybody laying on my table would have the same rotation of their pelvis to the same direction. And I just got curious with them, like, what's causing this rotation? And I realized that it was the movement of the sacrum and what was happening in birth. And then I just started palpating the pelvis and the pelvic bones. And I was surprised to find that our sit bone, the bones that you sit on, are called our ischial tuberosities. And one was more splayed out to the side than the other. And I'm like, "Doesn't the baby come right in the midline? Why am I finding it?" Like, that in my brain, I'm like, "Babies come out in the midline, and the pelvis opens up in the middle, and the baby comes out, right?" Well, that wasn't what I was finding in my mom's pelvises. And I kept finding right side ischium splayed, and then I found that the sacrum was way back from where it should be, and it just got me so curious. So I started studying more. What are the mechanics of birth, and what happens to the pelvis? And I realized that the ischial bones, your sit bones, do splay apart, and your tailbone does lift backwards to open up the pelvic outlet for a baby to come on out. And then as I started to investigate and inquire with my clients and ask them, like, "What position were you in when the baby came out?"
Laying on their back.
Right, a lot of them, but some of them would say, "Oh, I was on my left side."
Mm.
And when you're on your left side, that left side pelvis is anchored to the
Mhm.
it can't move. So the right side has to move more.
Mhm.
So that right ischium has to open up more, and that would cause that asymmetry of the pelvis. If a person had a leg bent up and the other leg a little more straight, that would cause that side to splay out more. And so I just started putting together and asking people, what position were you in when the baby came out? And then I'd go palpate their pelvis, and I would find what I thought I would based on the mechanics of what I know about the pelvis and the body. And so I've figured out how to release those patterns and how to get the bones back to their original position after birth. And moms were getting out of pain in one session. And they'd been seeing chiropractors and massage therapists for months, and their pain was just lingering. And this all started in 2009, 10. So then I was finding all these patterns and learning all this stuff about the postpartum body. And I started putting on YouTube all these, ideas and patterns that I was finding in the body. And I started getting emails from women all over the world saying, "Oh my gosh, I have exactly what you're talking about. Do you know someone who could help me?" And I was like, "Well, you could try a pelvic floor physical therapist, but they don't know what I know because I learned this all on my own." And then I just realized it's like, gosh, I'm having such great success with what I know and what I'm doing in the postpartum with the postpartum body. I need to start teaching this. And
Mhm.
so I started in 2016 is when I founded the Institute for Birth Healing. And I've been traveling the world teaching other practitioners, other body workers how to support pregnancy, how to support the body to prepare it for labor, and then how to recover it afterwards. And it has been my joy to know that my students get the same results that I do. And it's so fun for me to hear my students reach out to me after a class and say, "Oh my gosh, all these clients that weren't really progressing, I started doing the techniques you taught me, and now they're all getting so much better, so much faster." And
Wow.
it's yeah, it's so cool. And so one of the things, we were talking about the ischial splay, that sacrum lifting backwards. Sometimes both ischiums splay apart when the baby
Mhm.
comes out, and the body can get stuck like that. So what I'm recognizing is that the pelvic bones don't always go back to their original position after a baby comes out.
Mhm.
There are ways for us to help the body to bring those bones back together again. And this is something I just wish everybody after birth would do. There's an exercise I have on YouTube. It's called How to Close the Bones it's How to Close the Bones After Birth, the pelvic bones after birth. And you just do a resistance of your knees together and then resistance of the knees apart. So
Ah,
it's super easy. You don't want to create any pain. If there's pain, there's a greater
mhm.
dysfunction going on that they need support. But
Mhm.
if you could just after a baby comes on out and after mom and baby settle a little bit, even the next day, just have them, they're laying on their back, bend their knees up, just put your one fist between their knees and have them squeeze for 10 seconds as hard as they can without creating
Mhm.
pain. Have them relax, put two fists between them, and then put your forearm between the knees. And then have them put their knees together and you resist them trying to push their knees apart for 10 seconds, and then
Mhm.
bring the shoulder width apart and have them resist, but you don't let their legs move. And then you bring them out even further and you again have them push apart and you hold them there so that they don't move. And that uses the leg muscles to help bring those bones back into a more midline position. And that can help women's pelvic floor muscles be able to respond better. It just sets them up onto a path of greater success more quickly after
Mhm.
birth if we can get those bones back together again. And if this can be done immediately after birth, then the bones aren't stuck in this open birthing pattern for however long it is. And
Mhm.
like the body then doesn't have tissue memory. It goes right back
Mhm.
where it remembered it was initially. And
Mhm.
so, the pelvic bones being in what I coined the open birthing pattern can create a lot of different issues for us. It can cause our pelvic floor muscles attached to all those bones. So the pelvic floor muscles are unstretched, they're lengthened.
Mhm.
They're not strong when they're lengthened. And bringing the bones back to a more midline position helps to shorten those muscles so they're able to function better. When the pelvic floor muscles are on stretch, the vaginal opening it should be a circle, but when the
Mhm.
muscles are stretched, then it's more of an oval side to side. And that
Mm.
penetration, insertional pain with penetration with intercourse. You
Mm.
just bones together, then those muscles can relax and they can open to allow insertion to happen with
Mhm.
intercourse. A lot of women complain of heaviness vaginally after birth.
Mhm.
That heaviness could be either two issues. They could be dealing with a prolapse, and a prolapse is where the pelvic organs hang down lower than they should be. And the sooner you could get support with that, the better for your body if you are dealing with prolapse or this heaviness. Usually, a prolapse, the heaviness will get worse by the end of the day. That is a telltale sign that you're dealing with prolapse. If
Mhm.
you have heaviness that is the same when you wake up and when you go to bed at night, that's typically more of this open birthing pattern issue.
Mhm.
Pelvic floor muscles are hanging on for dear life, trying to keep your bones together. And so they're working overly hard, and that can create a lot of heaviness feeling in that area. So if you can do that exercise to bring your bones together again, that can put the muscles on a more slack position. They don't have to work so hard, and that heaviness goes right away. So
That's fascinating.
it's
I
so
feel like I need to lay down and do those exercises right now.
yes, a lot of women do, and again, if we could just have everybody who, has a baby vaginally just bring their bones together, and that's where, pelvic floor PTs, if they know and really understand and know how to work with the pelvic bones, they they're way more effective with the pelvic floor work because the bones are the housing for the pelvic floor muscles, and if
Mhm.
the bones are not in a proper position, it just makes it a lot harder for the muscles to be able to work there. And so one of the things that causes this open birthing pattern is when we're in birth can be a very, very challenging experience, as you, I'm sure, have witnessed, right? And sometimes it can be traumatic for the
Mhm.
person. And when trauma is involved, the body's responses are fight, flight, or freeze. Well, when we're in birth, we can't fight it. That baby's gotta
Mhm.
come out somehow. We can't flight from it. We can't run away from it. And so freeze is the most common response in birth. And what's helpful if you are doing these exercises to close the bones and they keep opening up or you don't feel like this exercise is effective, then that could be a sign that there is a trauma response in your body and you need to address that first. And
Mhm.
so working with someone who works with trauma, either a trauma therapist or someone who does somatic experiencing, somato-emotional release work, any of the practitioners that I've trained that have done my advanced work or my birth healing intensive program, they know how to work with that response in the body to help release it. And to me, when I sense into this, it's like the pelvis is holding its breath, like,
Mhm.
and it hasn't exhaled. And so we need to help it to exhale and know that it's not stuck in that moment in time because that's truly what happens during trauma is that a part of our body is stuck in that moment in time when the birth
Mhm.
happened, when it got to be too much, when it was overwhelming to the system. That's the trauma response in the body. And a part of us gets stuck there and the rest of us continues to live on and the body keeps going back to that moment in time, and you'll notice that with your thoughts or your memories, and you'll always go back to the same moment in time in your birth.
Mhm.
And that's your mind's way of helping you to realize where you're stuck, where you need support. And so there's all different kinds of ways that you can work with that. And I can help people do that over Zoom sessions, no matter where
Oh,
you
that's
are,
amazing.
and we can help heal that and get that energy flowing again and helping your body to relax again after the birth. And so just know that, and another sign is if anyone's had a cesarean birth and you
Mhm.
can't touch the scar is another sign of trauma. Or when you talk about your birth you tear up about it, that
Mhm.
emotional response is a sign that there's a traumatic response in your body still. And so I think it's just important to help people to understand why they are the way they are and why they, think about their birth and they get weepy or teary or angry or whatever the emotion is. And that's a response in your body and it's your body's just wanting support and needing
Mhm.
support. So know that there is support out there to help heal. And no matter what you're dealing with, there's always healing that can happen no matter how long it's been since you've given birth, whether it's 2 days or 20 years. The body can always heal. And so I
Mhm.
just want women to know that and understand that their bodies there's only a couple of things that happen during birth that aren't reversible. And prolapse can be one of them, but there's different stages of prolapse. And that what I find after birth is that after pushing a baby out vaginally, the bladder gets smushed off to a side. The cervix can be a little bit lower than it should be. But if we can help get the bladder back into place and we get the cervix to release some of the tension in the cervical ligaments, the uterine ligaments that support it, sometimes we can help get that uterus back into a more optimal position in there. And so a prolapse isn't a true prolapse. It's more of just an organ being out of place a little bit. So
Mhm.
that's on the more mild side. If you open your labia and you have a bulge right at your opening, that's
Mhm.
more a true prolapse. And we need to really get a good understanding of what is creating the prolapse. Is there a defect? Did a muscle kind of tear away from its attachment point? Did a ligament or a tendon rupture? And so it doesn't have the support system that it needs. And what's really important for women to know is that pessary use more immediately after birth can be super, super healing to the area. And so there is some research showing that if pessary use can help heal the tissues in that area. And so we want to get those tissues supported as quickly as possible after birth if there is a sign of prolapse. And so doing so can help actually the tissues, it can support healing. And we just don't know if it'll be complete healing where you won't have a prolapse anymore, or if it'll just support it, but you still have issues with the organs not staying in their more upright position. They're more in a saggy downward position in their body. And so prolapse is one of the issues that we just can't, there's no good surgical option, no good surgical repair that can happen. And pessary is your best option for supporting those organs. The only other issue that can happen during birth is, and we really want to try to avoid this, is complete disruption of the symphysis pubis joint. So that's your
Mhm.
pubic bone in the front.
Mhm.
And that usually happens when baby's not in the best position coming through the pelvis. And so baby gets stuck and the larger part of baby's head is coming through that pelvis. And then you hear a loud pop, and that
Mm.
can be a complete disruption of the ligaments that hold those two
Mhm.
bones together. If we have complete disruption where there's no ligamentous support to that pubic bone, there's really nothing that we can do other than maybe put a belt on it to try to support you or go have surgery to stabilize that joint again. But if the ligaments have completely ruptured, there's not healing doesn't really happen to that joint. So you need to find a way to stabilize it best you can. So those are things that we would love to avoid happening, and really that happens by us preparing our bodies for birth better and
Mhm.
making sure that baby's in a good position and baby's head is down, but not just down, but right in the middle, going into the midline of the pelvis, the inlet of the pelvis, and not heading off into a hip
Mhm.
and baby not being on one side of the belly all the time.
Mhm.
Baby and have both sides of the belly, and there needs to be even movement of that uterus side to side. That tells us that we've got even uterine ligaments in there. And when we have tension or tightness, baby goes where there's space. So if
Mhm.
baby's only hanging out on one side, it's because that's where there's space. And we need to create more balanced, even space in that abdominal area for baby to get into the best position to enter into the pelvis. And the other thing that we need to really focus in on for better births is to make sure that our pelvic floor muscles have nice, even, springy tone, and springy tone that can lengthen when you go to push. One of the biggest factors that cause the greatest tears is when women are trying to push a baby out and they tighten their pelvic floor muscles. And so it's so important that you practice this prior to going into labor. Really figure out, how do you push in all different positions. You can have your partner insert their fingers in vaginally, and I would recommend 2 fingers going in vaginally. Don't push down. If you think of that vaginal opening as a clock, right at 6 o'clock is the rectum. So don't push down at 6 o'clock, but just Spread your fingers on either side of the rectum. And how do you know you're on a pelvic floor muscle? You have your partner do a contraction, and if it moves underneath your fingers, you know you're on a muscle. And then you want to just have them practice. Okay, put your fingers in as far in as you can, and don't create pain though. If there's pain, then yeah, go get support and help. But with your fingers on those pelvic floor muscles, have your partner just push them out and see what happens. 80% of the time in my clinic, people tighten instead of bearing down.
Mhm.
And it's like, okay, that's the opposite of what you want to happen. Do
Mhm.
you realize when you're contracting your pelvic floor, it's the exact opposite of what needs to happen for a baby to come on out? It's like you're closing the door on your
Mhm.
baby. And so you need to learn how to lengthen and let that pelvic floor muscle open so baby can come on down and through. So your partner will feel their fingers lengthening and pushing out towards your vaginal opening. And that's what we're looking for. And if you start on your back and you can't get it, it's pretty normal because a lot of people can't figure out how to push on their backs.
Go
And
figure.
And so get on your side. You
Mhm.
can roll over, your partner can keep their fingers in on your pelvic floor muscles, roll over onto your side. And a lot of times then in side lying, people have a much better understanding of how to lengthen that muscle. Sometimes that doesn't even work. Get up on hands and knees. Keep your
Mhm.
fingers in back and just have your partner get up on hands and knees and keep your fingers on those muscles and have them push it out. And a lot of times the hands and knees position, they have a much easier way of accessing that lengthening of the pelvic floor muscles.
Mhm.
And then you could do it in tall kneeling as well, which is a lot more like pooping. So
Mhm.
birth baby is like allowing stool to come on out. And what do? You can practice when you have a bowel movement. What do you do to help encourage that stool to come on out? Do you engage your belly? Do you push down? Do you lengthen? Do you relax your pelvic floor muscles? It's pooping and birthing is the same mechanic, but a lot of people they don't poop correctly. So that's our problem, and that's really pregnant women listening in. You need to practice your pelvic floor muscle lengthening and how to push correctly. And so what people need to understand is that the pelvic floor muscles are the stoplight for birth.
Mhm.
That if you have red light tone in those pelvic floor muscles and there's too much tone in the muscles, the the baby it's like a sign to the baby, "Don't come out this way." In
Mhm.
fact, too much tension in the pelvic floor muscles will keep a baby's head high in the belly,
Mhm.
and it won't engage into the pelvis. So we
Mhm.
need to work on relaxing those pelvic floor muscles and making a more welcoming environment for the baby's head to come on down into the pelvis. So red light tone is like bricks. You put your fingers in and there's no give to that muscle. Yellow light tone, there's some give, but it's still resistant. And green light tone is like pushing on a trampoline. Your hand goes down and it comes back up.
Mhm.
And that's what we need for birth. We need that green light tone. So I had a client who came to see me. She was a doula and she was pregnant with her second baby. And she still to this day wins the award for the hardest pelvic floor muscles I've ever worked with in my career. Not a good thing to be
I
known
know.
for.
That's not good.
So, she told me that she was pregnant with her second one. In her first birth, she was trying to do a home birth, got to 4 centimeters dilation and baby stalled. Nothing happened. So she went into the hospital, got an epidural, and then baby came out vaginally. The reason baby came out vaginally is because an epidural bypassed the tone in her pelvic floor
Mhm.
muscle.
Mhm.
During her second pregnancy, we worked 3 sessions. Usually, I can get pelvic floor muscles to release in 1 session. So the fact that it took us 3 sessions to get some relaxation in those muscles tells you that there was a lot going on in those muscles. And so I worked with her, and we really worked on getting her to lengthen and let those muscles go and get some spring to it. She was successful in having a home birth her second pregnancy. But I guarantee it was because of the work that we did together.
Mhm.
If she had not done that, she would have gone down the same path. 'Cause those muscles were not willing to open up and to give and to lengthen.
Mhm.
So, it's just so important that the pelvic floor muscles lengthen so that the baby can come on out and that really can help avoid the tearing, because tearing happens when there's resistance and the muscles aren't lengthening,
Mhm.
and you're tightening your pelvic floor as you're trying to push a baby on out. That's what creates a lot of tearing, and
Mhm.
also pushing too fast, too soon,
Yeah.
right?
Don't blast the baby out. It's not a rocket ship.
Yes, yeah. So people are just like, "Oh, I just had to get it out," and they just push way too fast, too hard.
Mhm.
That also causes a lot of tearing. So in the postpartum period, if you did tear or if you did have an episiotomy, you really need to work on that scar tissue in that area and help to soften it and get it to release so that it's not hard, so that you can now have penetrational intercourse without pain. You can get pelvic floor muscles to be stronger because scar tissue just isn't is as flexible as normal tissue. So you
Mhm.
need to release and get that softer so that the muscles can function better. And the intercourse is actually the best mobilization for scar tissue. But if it's creating a lot of pain, don't just suffer through it. Go get help. Go find a pelvic floor PT. Work with someone who's trained with me. I have a directory on my website. So please check out and see if there's someone nearby you that has trained with me. They know the most respectful way to work with the body. They know the patterns to look for in your postpartum body, and they know how to best release them without creating pain. And if you've seen a pelvic floor PT and they've created a lot of pain, I'm so sorry. That should not be a thing, and they just don't know any differently. And so I'm
Mhm.
really change the way pelvic floor PT is delivered so that it's more respectful to our clients because we shouldn't be creating pain in this area, especially. So
Mhm.
there's so much that it goes on in the postpartum body that you need support after birth. I
Mhm.
really, really wish that every single person who's had a baby would be seen by one of my practitioners who's taken my postpartum course. So they know how to look for all the patterns in your body. They know how to help support you in your healing the quickest way possible. And, getting your pelvic floor muscles to be strong again, to function well, along with your lower abdomen. Your belly, your lower part of your belly below the belly button gets really more stretched out than what happens above the belly button, depending on where your baby grows. And most people, it grows lower than higher.
Mhm.
And that lower part of your belly can just get lazy after birth. And when
Yes.
you right? That's kind of that postpartum pooch that develops.
Yeah.
It's a lengthened muscle. And
Mhm.
so your upper belly didn't get as lengthened. So your upper belly is trying to help give you stability in your body. But when doing so, it sometimes pushes out that lower belly, and that actually can cause a little more pressure going down into the pelvic organs. And that can create leakage during stress incontinence, when you laugh, cough, sneeze, or exercise. And
Mhm.
it can also be the potential start of prolapse or making prolapse worse. We want to, after birth, you want to really focus in on getting that lower belly to draw back up and in as
Mhm.
much as the upper belly, more so than the upper belly, or think of it as a zipper where you start at the pubic bone. If you actually contract your pelvic floor muscles, then your lower belly draws back, then around the belly button draws back, and then your upper belly draws back, like you're zipping up a zipper up your belly. So that's a much better way to contract the abdomen versus a top down where your rib
Mhm.
cage clamped down and your lower belly usually juts out.
Mhm.
That that could be a potential cause for stress incontinence and prolapse. So just know that you need to get that lower belly activating more. And there's a ton of now online exercise programs for postpartum women. And you really do need to start with that foundational movement of understanding how to activate your core correctly so
Mhm.
that you're doing it and you're not creating these patterns that could cause more problems. And a lot of women are just want to jump right back into what they were doing before they got pregnant, and your body's not ready for it. It
Yeah.
really does need this foundational strengthening to help you to make sure that your core is supporting your pelvic organs. It's supporting your pelvis and your back. And I just want moms to know that if you're trying to exercise and your back keeps going out, or you're trying to get your pelvic floor muscle stronger and it's like you're hitting your head up against the wall, the open birthing pattern could be one of the reasons.
Mhm.
And find someone who can help you to close up that open birthing pattern. If you're seeing a pelvic floor physical therapist and you're not getting better, please encourage them to take one of my holistic treatment of the postpartum or pregnant body courses. they'll have much better skills to help support you
Mhm.
and getting you to heal.
Mhm.
And it truly is my goal and my dream to have a certified birth healing practitioner in every city in the world so that moms can really get the care and the support that they need after birth.
That's so amazing. I love what you were saying about the somatic experience, because even if you go to get pelvic floor physical therapy, if it's causing more trauma, or if it's causing the same sensations that the trauma caused, especially if you had a tear or a episiotomy, to go back and stretch that scar tissue. I'm just thinking about when I went to pelvic floor physical therapy. I was like, let's not stretch the scar tissue anymore. It was just intense. I love your approach of trying to get those muscles trained and get your bones back together, because the more I learn about how to get the baby through the pelvis, like we all took spinning babies at the hospitals that I work at, and just understanding how to move and how the pelvic bones articulate and all of that stuff to get the baby through the body. When we're doing it correctly, yes, we are pushing on our side, which, yes, that, I mean, if you are pushing in a atmosphere with gravity, you're gonna have some bones that are locked in place unless you're standing up or
Right.
squatting.
Yep.
But if you have an epidural, that's probably not going to be possible. Even if you're on your hands and knees, you're locking something, you know?
Right.
There's something's going to be locked, and maybe your sacrum's going to lift, or the front part of your
That,
pelvis.
yeah. The hands and knees position is actually the best position for birth
Mhm.
because the
Yeah.
pelvis is open. There's not any pressure on any of the bones that need to open. Hands and knees is one of my favorite and one of the positions that I don't find as much issues in the pelvis.
Mhm.
When we're talking about squatting, a supported squat is much better than an unsupported squat. So if someone
Mhm.
is sitting with pressure on both legs and both legs are supporting them, there is a greater risk of the pelvic tearing of the pelvic floor muscle.
Mm.
But
Mhm.
if you unweight your legs, so you maybe are hanging over your partner's legs, and so that your lower body is dangling, or you're
Mhm.
on the bed so that your legs are unweighted,
Mhm.
that's pressure off the pelvic floor muscles, and there's less chance of them tearing in
Okay.
position. So that's
Which
something
is
to
hard with an epidural.
Oh, yeah. And with an epidural.
Yeah, we have squat bars and we can lower the bed and we can do all sorts of stuff, but I think we would still, for the most part, have some weight on the legs. We
Right.
we really don't push that way very often. I think the only time in my career that I can remember actually delivering a baby in the squat position, it was a mom that came in without an epidural and just basically dropped her baby. She was like, I have to do it this way. And I was like, okay.
Yep. Yeah.
So
That's awesome,
yeah,
right? That her
yeah,
body chose a way to do it, and that's really what should be happening. But
exactly.
I think in our society, we're afraid of pain. And
Yeah.
as a generalization, right?
Mhm.
Anytime we have pain in the body, our first instinct is let's get rid of it.
Mhm.
And and birth is intense. There's a lot of
Mhm.
intent to what is happening in birth. And I think the intense pain, contraction, expansion, whatever you want to call it,
Mhm.
is so intense, but yet people pathologize that
Yeah.
and think that pain equals bad. But in birth, pain just means that things are opening that have never opened in that way before.
Mhm.
If you can understand that yes, this is painful, but it's an okay pain. It's not a detrimental pain. It doesn't
Mhm.
mean that something's wrong. If we can embrace that and work through that, then I tend to see in my practice that women who get epidurals don't have as many traumatic responses in the body than women who don't. However, I do feel that it's a different pathway for a baby when a mom
Mhm.
gets an epidural. And so I would just recommend, I tell my mamas, all my pregnant mamas, like, your main goal is not to suffer. Suffering is not the goal here. So if you are suffering, you need to get whatever you need to not suffer anymore.
Mhm.
It that's an epidural, that's an epidural. You give in to that. It's okay. But no matter what you do, whatever's happening in labor, talk to your baby and let your baby know what's going on, because that baby is a very conscious being and it is
Mhm.
taking everything that is happening during that birth process. And so when you get an epidural, the baby feels like you go away. You do.
Oh, that's interesting.
You disconnect is no longer connected to your body because you're not connected to your body.
Yeah, you're not moving in response to anything anymore. Ah, wow. That's like my mind is just flown. I hadn't thought of that ever.
And a lot of people don't.
Hmm.
And so there's pros and cons to everything.
Right.
And we need to just understand, what are we choosing here? And
Hmm.
if it's an epidural, that's fine. Just let the baby know, hey, baby, it's going to feel like I'm going away, but
Hmm.
I'm not. I'm right here. I'm going to be talking you through it, but it's going to feel like I'm gone. Just know that I'm
Hmm.
still, we're doing this process together.
Hmm.
And then if you end up having to need a C-section, then you're just like, okay, babe, we got to do this now. This is what's going to happen. We're going into surgery, and we got to get you out now. And so just talk to baby, let baby know. And
Hmm.
it's thing, especially in cesareans. I was able to witness a cesarean birth, and they immediately took baby off to the warmer, and baby was just so upset, upset, upset. And I just went to dad, like, Dad, go put your hand on and go talk to your baby. And as soon as he did, that baby just calmed down, because it's like, what the hell just happened to me?
Hmm.
And it's like, where am I? Who are these people? And what's going on? Like, think about that. Your baby is a very conscious being. And that's why babies can be so fussy afterwards, because it was a hell of a process for them.
Right. They're trying to talk about it.
They are. They are. And so if you can just listen and let them just, cry and let them express, just understand that that's what they're doing, it can help them settle more after the birth as well. So
Yeah.
it's everybody's involved in that birth process, who's ever in that room. Your partner can be traumatized just as much as you are, and
Oh, yeah.
even more, because
Hmm.
there's nothing they can do when you're in pain. There's the worst thing in the world for a man to feel, especially a man, because
Hmm.
men try to fix things, save things, help you. And for you to be in that much pain and there's nothing for them to do, that's a traumatic experience for them.
Yeah, especially if they're the ones that caused that pain.
Right? They put
I
you in
put
that.
that baby there.
It's a big event. It's a big event, and
It
it
is.
does take it on the body. And I just want people to understand that another issue I find is, this one isn't as common, but it's a huge issue, and that is difficulty taking a deep breath. And what happens is that when you're pregnant, that baby is taking up so much space, and depending on what that baby chose to push against as it was growing, if it's pushing, your liver is on the right side of your rib cage of your body, and stomach's on the other side. And baby can use that liver kind of as a punching bag or kicking bag. And it can push up into, and it can really bruise your ribs, but
Yeah.
that liver is intimately connected to your diaphragm, especially for our shorter waisted mamas. They will arch their rib cage up in the front to make more room for baby. Well, that
Hmm.
tightens the rib cage in the back.
Hmm.
And so now the rib cage in the back can't expand out like it needs to.
Mm.
Put your hands on either side of your rib cage, so your thumbs are in the back and your fingers are in the front. You wanna take a deep breath in and allow your rib cage to expand out to the side, and your thumbs should move just as much as your fingers do. If you find that your fingers are the only thing moving, you need to make sure that you can start trying to breathe more into the back part of your rib cage. If you just fold yourself over onto an exercise ball, or put a pillow on your lap and just fold over on top of it, and then just breathe into the back part of your rib cage, and just get that moving more, that can help. But sometimes that liver needs help coming back down, and finding its happy home again, versus being jammed up. When it's jammed up, that diaphragm can't have its full excursion, and it can really cause people not to be able to feel like they can take a deep breath. And I've
Hmm.
had women fly in from several different states with this issue, because they go to a doctor and the MRI is clear, the CAT scan's clear. The doctors are like, yeah, I don't know why you
What are they
can't breathe.
gonna find?
It's a restriction in mobility of the
Right.
diaphragm, and they don't know how to work with that. And
Yeah.
sometimes restriction is coming from the organs itself. So
Hmm.
the liver and the stomach need to find their way back down into the abdomen to take the pressure off of the diaphragm for it to be able to function well. I had a mom who carried twins, and one twin was horizontal across her upper rib cage. So the baby just kind of like stuck right underneath her rib cage there. And for 2 years, she could not take a deep breath. And she came to see me, and in one session, she was able to take a deep breath again. And I ran into her the next day and she goes, "Oh my gosh, I cannot believe I'm not hyperventilating because I can finally breathe normally in the first time in 2 years."
I mean, if you think about it, like, here's what I love about love being sarcastic about allopathic medicine. Like, me as a nurse in the allopathic medical field, coming from a family of a surgeon and nurses, if there were a patient that had a tumor taking up their whole body, right, their whole abdomen, pushing up on their liver and on their organs and everything, and that tumor was removed and that patient still had problems breathing, I am 100% sure that any doctor would say, "Oh yeah, it was that stupid tumor. Yeah, you got to let your body like reshift." But pregnancy? No, that's a normal condition. It can't cause the same thing.
Right? You're
Right?
spot on. You're spot on, Kelly. Spot on. Yeah, and
It's
that's
not the same.
right. And I just this idea of like even scar tissue, like what's super crazy, and you see this all the
Uh-huh.
time in the hospital, if someone has a total knee replacement or a total hip replacement, they get physical therapy twice a day for however long they're in the hospital. And then they get home health while they continue to heal and they go to outpatient therapy. And even if they get gallbladder surgery, they have physical therapy to come to help them to recover. Very rarely in a lot of hospitals across the country do they have any physical therapy or occupational therapy support for anyone who's had a C-section.
Mhm.
A C-section is major abdominal
Mhm.
surgery.
Yeah.
And here's the problem is that you are in this electric bed with guardrails,
Mhm.
handrails on each side. And so you can put the bed up and you sit in a bed at a 45-degree angle all day long while that scar tissue is healing. You maybe only lay it down flat to go to bed at night. But then when you go to roll over, you use the handrails and you've got that to help push you up. And then they discharge you and you have to go figure out how to do that all on your own at home.
Good luck.
Flat bed with no handrails
With a baby.
with a baby.
And
It is
learn to
just
breastfeed.
absolutely yeah, it's absolutely asinine
Mhm.
there is 0 care for the pregnant and postpartum person in a hospital after giving birth.
Yeah.
Just
Well, I mean,
0.
even now they're making do pre-physical therapy. They're making people go in before their surgeries to
Right.
get physical therapy. We don't do that with pregnant people. And that's
No,
the biggest change that your body can have.
absolutely 200%.
It's 100% total transformation of your body. But no, you don't need physical therapy for that. Mm-mm.
It's ridiculous, and I'm really, really, really grateful to Rebecca Seagraves as a colleague of mine. She's a physical therapist. She has a pathway that she's developed for postpartum recovery after cesarean births,
Oh,
and she
amazing.
is a pioneer trying to get the word out, get the research out to show hospitals that we can actually decrease readmissions, we can decrease dehiscence, which means the wound opens up again after you have surgery. We can reduce all of that by having a PT and OTC all postpartum cesarean births in the
Yeah.
hospital before you go home. Because you
Mhm.
need to learn, you need to figure out how the heck do I get out of bed without a bed rail and an elevating bed head?
Before the administrator, because I can hear the administrators in my head saying, "Oh, well, the nurses could teach that," because they tell us to teach people how to do that. First of all, we aren't physical therapists. We cannot
Right.
evaluate. We cannot diagnose. We cannot treat. We can only do what was put in the orders for nursing care. Second of all, having worked postpartum, 5 couplets is what we usually have. So how am I supposed to do that? I mean, I'm basically like getting people up to go to the bathroom and then getting them back. And that's the extent of the physical therapy care that I'm able to do with a patient. Like, can you stand? Can you take a step? If not,
Yeah.
please sit down. Let's try again in an hour. That's about all I can do. Grab your side rails, hold the thing over your belly to cough. That's it. That's all we do. It's not feasible. I mean, any other place in the hospital, if there was a physical therapy concern, they're going to call a physical therapist. So please don't think that you're going to teach your nurses to start doing physical therapy. Like, let's add physical therapy to the normal postpartum care, even for a vaginal delivery, I would say as well.
Yep. I remember when I worked in the hospital years ago, I would only get called in if there was significant syphilis
Yeah.
pubis function and pain, and mom couldn't stand up to get out of bed. But
It's
back
hard to
then,
get them there for that. I'm
I know.
challenged to get the physical therapist. I mean, not with any fault of the physical therapist. It's just the sheer magnitude of workload that they have in the hospital, and
Yeah.
not just workload, but like the scope, because it's not like we don't have any pelvic floor physical therapists in our hospitals that come see patients that are
Yeah.
specifically trained in
Yeah.
just, like we should have lactation consultants and we should have pelvic floor physical therapists. That needs to
Absolutely.
happen. And
Yeah.
therapists, just like emotional health therapists in the hospital.
I
Like
know,
that
right?
all needs to be on the postpartum floor, all of it.
Absolutely. To help deal with the trauma that just occurred in that room from the
Hmm.
birth.
Hmm.
I totally agree. And until we take this seriously, it really does take champions in each hospital.
Hmm.
And those champions, like, so if you have to find the PTs and OTs that are willing to start a
Hmm.
program, to see these mamas, to
Hmm.
know what to do with these mamas. And then you need to find the OBs, a champion in the OB realm, to start that process.
Hmm.
And like I said, I'm super grateful. Rebecca Seagraves is doing a great job trying to get the word out. But until we find those champions in each hospital, that level of care is not happening. And so moms, you need to do the best job you can in trying to educate yourself. And please, a lot of moms go, well, I'm not going to have a C-section, so I don't need to worry about that. But I have to tell you, if that's one of your greatest fears, what I know in my clinic and what I hear all the time from my clients is that their biggest fear that they did not address is what ends up happening in the birth.
Exactly. I have this post that I that I occasionally put up that says, I can tell the kind of birth that you're going to have based on your mindset. And if
Yeah.
your mindset is, I'm not even going to entertain this idea,
That's where you're going.
right.
Yep, 200%. Yeah,
Yeah,
so true. And I tell my mamas, have a good plan and throw it away.
exactly.
Have a good plan, but throw it away and be in the moment and do what
Hmm.
your body needs to do. And it's a dance between you and your baby.
Hmm.
And just recognize that when you get an epidural, your dance partner, you get put in the sideline because your body
Hmm.
can't participate in doing the movements that need to happen in order to get the baby out. So now the baby's
Well, the
kind of on.
nurse becomes the dance partner with the baby.
Right. Well, trying to manipulate your body,
Yeah,
right?
right.
Yeah.
And then the
Yeah.
baby is basically doing the solo after every
Yep.
position change. We'll see what the baby can do.
Yeah.
Yeah. I mean, it's doable. It is doable. And also,
Yeah, and I don't wanna shame anybody for anything that I've
yeah.
said. Not these comments are not made to shame anyone. I
Hmm.
just want you to know the reality of what happened
Hmm.
and make informed decisions with
Hmm.
what needs to happen. Like I said, you're not meant to suffer, so don't suffer. There are options though, and I think that a lot of times we go into birth a little naive.
Well, how
And
can we not?
yeah, that first experience is there's nothing else like it because 'cause you've never done it
Mm-mm.
before.
Exactly.
No. Yeah, and so you really are at the hands of your birth team. So
Hmm.
get a doula in with you. I That's my
Hmm.
biggest thing that I promote in my practice is, do you have a doula? Because they've been there, they will be with you the whole time, and
Hmm.
they know the labor process. They know how
Hmm.
to support you in it. And then that labor nurse hopefully can come on and, you guys all work together to make
Hmm.
your wishes happen. So it's so important to I always tell my mamas, listen to your body. What does your body want to do? Because that's what needs to happen in birth. And so the more you
Hmm.
can practice that in pregnancy, it's like, oh, okay, I've been sitting for a while, so my body needs to stand up right now. And
Hmm.
listen to that and doing the stretches that your body feels like it needs to do. That's all listening to your body and helping to know what it needs in the moment.
First of all, doulas, love them. And also, when looking for a doula, if you're going to have a hospital birth, make sure that doula is comfortable and happy and feels at home in the hospital setting so that
Yes.
we can all work together. That's my soapbox. I love
Yeah.
them. If I can work together with a doula, there is no better birth, because as the person that has just met the mother, to read the room, to gain rapport, to feel out what the desires, the wishes, the energy, everything. And that means that I'm not going to sit and stare at someone. I'm not going to be at the bedside typing on my little computer. None of that. I mean, I'm going to get everything ready and then I'm going to step aside and let labor begin. and let things happen. Because that birth space isn't necessarily my space. While it is my workspace, it's also this space for this beautiful, magical event to happen. And if I'm not the person that you chose and hired to be your support person, I'm kind of in the way if I'm in there too much.
Oh, I love
So,
hearing this, Kelly. Awesome. Awesome.
so until I feel invited and welcomed and like I'm not bringing up any stress or negative energy or, because you're so vulnerable and there's so much going on, you're doing all these
Yeah.
things with your body that are supposed to be this release, that it's supposed to be, you're supposed to let all your inhibitions go. If I keep jumping in the room to like chart or
Yeah.
take your blood pressure or be like, how you doing? Hi. You just got in your flow and now I'm going to come in and bust into your room and I'm going to try to give you your space, right? Because this is a process that you and your baby are doing together. I don't enter in unless you need help or unless we are moving things along with medication. So if you have someone that you have built rapport with, that you trust, that knows what you want from your birth because you worked together and that you trust to be able to do that birth process, that dance of labor together, I don't want to get in the way of that. And if you need medical intervention, I don't want that person getting in the way of helping you and your baby. So this is how we work together. And I love having a doula that understands that. The
Yeah.
other thing that keeps coming up for me, I notice when we get to the point where the baby is coming through the pelvis, there's a change that happens to the shape of the bottom, like the mother's bottom. You can see like the sacrum lifting.
Yes. Yes.
And can you talk, because that doesn't always go back.
No, it doesn't. That
Tell me more.
that that is called sacral flexion. Okay, so the sacrum, where the tailbone lifts backwards, goes into sacral flexion. That's what helps open up the outlet for the baby to come on out. And yeah, the sacrum can get stuck there, and the pelvic floor muscles are on stretch. There is a ligament from the tip of your tailbone that goes, it's the anococcygeal raphe that goes from the tip of your tailbone to your sphincter muscle of your anus. And I know, Kelly, you have seen a lot of tension around that anal sphincter muscle. And I always, always find knots in the pelvic floor muscle, in that anal sphincter muscle itself. And if you have a grade 3 or grade 4 tear, that goes into that sphincter muscle. And so, along with the scar tissue and the knots, that sphincter muscle can be held open and it can put strain on that sphincter muscle to open it up. And so we need to help get that sacrum back to its normal position so the tailbone comes more forward. That takes the strain off of that so that the anal sphincter muscle can function better. Some of the signs people have when that anus is held open is that they feel like they have an incomplete emptying of their bowel, or when they go to wipe, they constantly have to wipe, and they're never clean because that sphincter never closed off the stool and it's held open. So there's constantly stool there. And so seeing a pelvic floor PT, someone that's trained with me would be ideal because they know how to get that sacrum out of flexion. They know how to work with that EAS to the sphincter muscle to get rid of the knots in there and to help it to close back down if it can. And so it's so important. So when that sacrum is stuck in flexion, mom's biggest complaint is that they can't lay on a hard surface on their back. If you think about it, so
Mm-hmm.
this, the sacrum is now here.
Mm-hmm.
So when to lay on a surface, it's the sacrum is poking harder into the floor. And
Mm.
not coming forward. So if this sacrum's in its normal position, it doesn't have that much pressure. There's more spread in the pelvis area where the pressure is when you lay on the ground. But when you lay on the floor and you're in sacral flexion, all that pressure from the sacrum is hitting
Mhm.
the floor. It's uncomfortable. The sacral flexion causes so many, and I call it the most hidden pattern in the pelvis. It can be very elusive in finding it. And so I've
Mhm.
been teaching my colleagues and my students to really look for it because I'm finding it more and more and more and more the more I work with postpartum clients. And it's just so helpful to help it to come back. So the knee exercises, the squeezing of the knees,
Uh-huh.
that helps more than ischiums. That doesn't help that tailbone in coming forward. And so seeing a pelvic floor PT or someone who I have a free online course. It's
Mhm.
called the Sacral Flexion course, and it's
Mhm.
free. And practitioners can take it and learn about this pattern and how to treat it.
Mhm.
And there's a exercise program that you can do to help encourage that sacrum to move back forward again.
That's
And so
amazing.
I love that you see that and you're like, yeah, it's not going back.
Yeah, everybody's butt looks different after they have a baby. I'm like, where did that come from? Yeah, I mean,
Yeah.
even mine. I have a 5-year-old, and I look and I'm like, why does my butt look different? Like that's been bugging me for 5 years. Like
Yeah.
I'm pretty sure it's my sacrum, and it's not where it's supposed to be.
Right.
So
Yeah.
yeah, I'm gonna
Yeah.
be taking your course.
Okay. Yeah. Learn how to do it and see if you can, figure
Help
out.
mom. Yeah.
So
Yeah, I'm constantly playing with pelvises. So pelvi is that
I think that is the plural.
pelvises?
Yeah.
Pel.
Five is the pelvises. Yeah. I don't, yeah.
The other question that I had was you talked about the baby being on one side,
Mhm.
and I'm gonna go a little bit TMI here. I when I was pregnant with my son, in order to have a bowel movement, I had to lift him off of my rectum, and then he would go right back. And then of course he came out LOT, which is left occiput transverse. And
Mhm.
we ended up with an episiotomy and a vacuum because I just felt like I couldn't. Not only was my epidural so amazing, thank you to the anesthesiologist that made
Yeah.
me completely numb from my nipples down. It was great. It worked, but I couldn't feel anything to push. And I felt just powerless, which may or may not have had anything to do with the epidural in reality, because if I'm relaxing my pelvic floor and my baby's in the right position, hardly any pushing needs to happen, right? My
Right.
uterus will push everything out, everything will just flow, baby will come out, birth itself essentially. But if your baby is stuck in your weird shaped pelvis and you're pushing on your back and your baby's been in this funky position that is essentially LOT for several months, what kind of dysfunction are we
Yeah.
looking at here?
I would want to check out all your uterine ligaments. So is
Mm.
quad ligament tight on that left side, so it's pulling baby off to that left side? Do you have a rotation? Is your uterosacral ligament tight on that left side, so it's kinda causing a torquing, pulling back on
Mm-hmm.
that side? Is the round ligament tight? The round ligament, so ideally, the baby's head should be in midline and the fundus should be directly above it. If the fundus is off to one side, that's telling me that round ligament is pulling it off to
Mm-hmm.
that side. And so then that causes babe to kind of be in a crooked and squashed position in your belly,
Uh-huh.
and don't have the space in the room to get their head in a better position. So releasing all those ligaments is
Mm-hmm.
super, super important to try to help baby's positioning in the belly. And what's really cool is the linea negra, that brown
Mm-hmm.
line that goes up the belly,
Mm-hmm.
that gives clues as to where there's tension in your body. So that line should be directly. So here's something that you should do, Kelly. Every pregnant mama, let me see your belly.
Mm-hmm.
Let me where, what's that line doing? Because it should be straight up and down, and the top line going through the umbilicus should be directly underneath the umbilicus. A lot of times, tension, that bottom line will head up towards the belly
Mm-hmm.
button, curve to the side. That's telling you there's tension where that line is going.
Okay. Putting the mom on the opposite side with like a
Well,
support, would that be helpful?
possibly,
Okay.
possibly. So, ideally, they're working on this before they get to you.
Yeah,
That's
they never work on anything before they get to me. So
yeah. So doing some, I don't know if you can, do some massage work to try to
Mhm.
help relax or lengthen that posterior. Usually, if it's coming up and it's going towards a rib, it's tightness in the back. So getting
Okay.
them to like try to breathe into their back rib cage can really help. So babies whose heads are off to one hip,
Mhm.
usually the opposite side back wall of the rib cage is tight, pushing baby into that direction. So if we can get more space in the back body opposite where their head is, then their head can find more room towards the midline.
That is
So there's
so interesting.
Yeah, there's just so I would encourage you to follow Gabrielle Brennan. She's a
Okay.
midwife in Australia, and she has amazing Instagram stories and posts that she puts on. Just go devour hers because she talks a lot
Mhm.
about baby's position in the belly is telling you where there's tension in the body
Mm.
and what you can do about it because you can do the sideline releases from spinning babies. You
Mhm.
could do the inversions to try to help release those ligaments. Those are the only things that you can really do in that moment. But I would love, it's my dream to teach all OBs and midwives and even labor nurses how to release the pelvic floor muscles internally during birth to help with that opening up because I've trained other midwives and they told me that when baby stalls or labor's not progressing, if they go in and release the pelvic floor muscles, babies come right on out.
Yeah, I find the same thing. I can't push with a patient. No, if I'm with a midwife, then they're doing this, right? But I can't tell a patient, I can't give them feedback until I have felt those pelvic floor muscles. And if I
Yeah.
feel tension there, I'm like, you gotta blow it away. Come on. I had a great teacher. Well, it's the same teacher, but the second time I took spinning babies, she showed us how to lay the mom on the side and push up against the side rails to engage that lower abdominal core,
Oh, uh-huh.
which it's game changer. It relaxes the pelvic floor and engages those muscles below the belly button, which I was trying to describe to women that had epidurals because I remember that that's what I engaged when I was able to feel myself pushing. But if you have an epidural that's so dense and you can't feel it, the only thing
Yeah.
you can do is just the body mechanics in order to subconsciously engage. Like if you're pushing at a right angle with your hands, you can't not, with your knees drawn up, you can't not engage your pelvic or
Yeah.
your lower abdominal
Yeah.
muscles and
Right.
relax your pelvic floor. And so then
Yeah.
when I roll them back over, it feels like a completely different pelvic floor. And they're bringing the
Awesome.
baby down. And then I can feel that space below the baby's head. And I'm like, okay, you got a couple more inches to go, and then we can like actually get some movement. It's amazing.
It is. So I teach in my courses, I teach my practitioners to do a hug and hum. So
Mm.
hugging the belly back is that TA activation that you're talking about.
Mhm.
So hug the baby in. And to me, that, like you said earlier, the uterus knows how to push that baby out, whether you're conscious or not. So
Mhm.
the uterus is doing that top down contraction on its
Mhm.
own.
Mhm.
And fibers, that's how it's meant to work. If we try to just bear down from the top, we're like pushing the top of a toothpaste. So, the cap's open and we're at the end and we're just trying to push up there to get the toothpaste out. But if we grab the toothpaste in the middle, like that transverse abdominis around the belly, and we squeeze, way more toothpaste comes out. Can hug the baby back. That gives the uterus more support to do what it needs to do in the pushing phase.
So then how are we engaging those muscles? What are we doing?
So breathing out, exhaling,
Okay.
and drawing that lower belly back. It's very similar to what you're doing with the
Mhm.
pushing of the hands. It's just without using the push of the hands, can you actively engage that? Which they may
Mm.
not do if they have an epidural. So
Mhm.
if they don't have an epidural, and I teach this in my clients because I want them to practice this before they go into labor. So if they do have an epidural, they still have that muscle memory. Just like hug baby back. And then the humming is those lower tone. I'm sure in the labor room,
Yeah.
you hear a lot of low guttural. I call it.
Well, if I tell them to do it, otherwise they're screaming. I'm like,
Like,
stop.
yeah, because the screaming actually causes them to tighten,
Mhm.
right? But if
Yes.
they can get into that low guttural, like I say didgeridoo, like,
Mhm.
"Uh," that lengthens the pelvic floor.
Uh-huh. I love that. Yeah. The hug
So,
and hum. I'll have to remember that because once we flip over, sometimes everything kind of
yeah,
goes back to where it was. I will definitely try that.
yeah, let me know.
I
Find.
think that was all of the questions that I had. Was there anything that we didn't cover?
No, I think we talked a lot.
Yeah, well, definitely send me all those resources because those are amazing. I'm really excited to like look through them and, add more stuff to my practice because I just it hurts my soul when somebody comes to me and none of the things are aligned and none of the things are in place. And it's like, wow, I've got a lot of work to do in 12 hours. And the first thing I have to do is gain your trust. And then we'll see if I can do any of the other stuff. So,
Right.
so challenging. Well,
It
thank
can
you
be.
so much. I love the work you're doing. I love that you are trying to get all of this out, all this information and resources out to moms and pelvic floor physical therapists. This is amazing. And that you're incorporating the somatic and emotional part
So
of all
important.
of
It
this.
creates a deeper healing,
Yeah,
a complete healing. And that's why I'm able to get the results that I get in less sessions because I do
hmm
incorporate it all. And it is, we're body,
right.
mind, spirit, all one. You can't separate
Well,
it out.
you can't. And trauma lives in the body, and you can
Yes,
try to physically get rid of it. But if you haven't emotionally gotten rid of it, it's not going anywhere.
right. You know it. Yeah.
Well, thank you so much. I look forward to all that you're doing and having this episode out so lots of moms can learn how to take care of themselves.
Thanks for having me on, Kelly. Thanks everybody for listening.